Hundreds, maybe thousands of people are without a pain doctor following the suspension of Dr. Michael Cozzi's medical license. A federal investigation is underway into allegations that he was overprescribing medications.
And News Channel 15's Angelica Robinson talked with Allen County Health Commissioner Dr. Deb McMahon. She joins us now with more on how the health department is handling this.
Well, Dr. McMahon says she's been talking with medical professionals and law enforcement to figure out a way to minimize the negative impact for those patients. But the reality is there's simply not enough pain doctors to take on all the patients in need. Dr. Michael Cozzi's office has closed its doors, at least for the next 90 days, and pharmacies cannot fill his prescriptions. Now people in need of care for chronic pain are trying to figure out what to do next.
People are wanting to know what to do, and I don't know what to tell them to do. The emergency rooms, they cannot prescribe like that. Again, there are prescribing guidelines in place.
According to Dr. Deb McMahon, their best bet is visiting a primary care physician. The physician could refer them to a new pain doctor.
This disconnect between how people were being treated by this certain physician and then how people who are practicing the standard of care are going to provide care. And I think there's going to be a big gap, and that gap is painful.
It's likely that new doctor would make changes, which could be a difficult transition for some patients.
My guess is a lot of his patients are going to find themselves in a situation where other doctors do not think that that medication regimen that they're currently on is appropriate.
The Health Commission is working to provide resources for doctors dealing with patients suffering from addiction.
What are some good regimens for withdrawal and detox and those sorts of things? So really just a lot of information because again, if you don't see a lot of these patients, that's a lot of work to go and look and see, well, what's the best practice for right now.
The Health Commission will have a meeting on Monday to finalize their plans. Information on how doctors should handle this situation will go out to them early next week. Angelica Robinson, News Channel 15.